So I think when you put together leading experts within their own field of pancreas cancer, I think that's when creative solutions, new hypotheses are developed. And so I think that's where the science is going to be accelerated, is collaboration across institutions, collaboration across experts, figuring out how we can combine all of the things that we're working on individually to come up with new solutions for how to battle pancreas cancer. And so I think that's where down the road, I absolutely do believe that this is going to translate into creative scientific solutions, new clinical trials, new exploration of therapeutics, new ways of combining our therapies. That's what I foresee as the mechanism through which this type of initiative would accelerate the science. So I think it's just challenging for 6 institutions to come together and to find the time to share best practices, to share data in an organized manner. And so providing that platform, providing that organization is the real strength of this initiative. I think that this would be something that would be very, very challenging to do organically. And so working with an initiative with a platform like Canopy, with the partners that they have brought on the team who have experience with quality improvement, with the development of learning health networks, that is really the key of this initiative. I think, again, it would just be very challenging for that to happen naturally, even though there's such an opportunity for us to just simply communicate with each other. Again, share what we do that's working well, share what we do that where there's room for improvement, and therefore come together as a group and improve the delivery of care for pancreas patients. So we're very excited about being part of this Learning Health Network. We think that there's great opportunity to learn from the other institutions that are participating in this initiative. But the goal here is to share our data, to share data between the institutions, to share best practices, ultimately to learn from each other, to teach each other, to reduce some of the variation in pancreatic cancer care that exists today, and ideally to improve the care of patients with pancreatic cancer. Yeah, so what gives me hope is the passion and dedication that's reflected in all of the provider teams at each of the 6 institutions that's participating, and honestly that I think is reflected in anyone who takes care of patients with pancreatic cancer. Of course, it's a devastating disease. Of course, there's room for improvement. Of course, outcomes are not good right now, but things are improving. We're absolutely in a better place today than we were 5-10 years ago. And I think that there are a number of areas where we can do better. And I think that learning from each other, learning from people who do this regularly, again, is the real strength of this initiative. And is just such a great opportunity. Why has this not happened? I think it's just the challenge with bringing busy teams together. And so having that opportunity now to do that, to learn from each other, is really what gives us hope. It's provided momentum within our own group as well. Being part of this initiative, I think has really energized our team, the provider team, but really everyone who takes care of pancreatic cancer at our center. Some of these early successes that I referenced, all of us are really excited about that. We're all excited about future opportunities as well. There's a list of, already so many, areas that we want to work on, so many ideas that we have, and doing it as part of a larger group, I think just adds gravity to the need to do that, and to the desire to do that. So I think it absolutely has energized our whole team. I think that's reflected in all of these meetings that we've had together. as a group, because I think we're just really excited to work with each other and to develop some of these really important initiatives that we think can improve things.